This technology is www.edheads.org. This is something that I've been using for probably about the last 5 years. It's a great web-based resource that works on all platforms that I use, mainly with my students in mind. I'm always trying to find educational websites that are appropriate, but also kind of, use those higher order thinking skills and help the kids think outside of the box. The intended audience would be K through 12 students. I'm using it in my elementary classroom, although sometimes it is not, it's a little bit harder to do some of these activities. I used it quite a bit when I worked in a K through 12 setting and had older students. The two IST standards are 2B, model and promote the frequent and effective use of technology for learning, because this is a great website for students to use. And also 3D, which is staying abreast of educational research and emerging trends regarding effective use of technology, and encourage evaluation of new technologies for their potential to improve student learning. The reason why I chose that standard is because the activities that are on here are very science related, and it's kind of basically like being along in a surgery room or getting to do different things and kind of doing those Common Core and career readiness standards at the same time. So to show you a little bit about it, there's a teacher resource center. Mostly what I do is I go to the choose an activity and let the students choose an activity. And there's lots of different ones: aortic aneurysm surgery, choose a prosthetic, crash scene investigation. There's machines, deep brain stimulation, design a cell phone. As you can see, there are a lot of different ones. The cool thing, I'm going to click on this first one. And the cool thing about it is that it's very interactive. It also gets the students to utilize a lot of their, motor abilities and those different types of things. Hopefully you can hear this.
Hi, I hear you are the new surgical resident. I'm glad you chose vascular surgery, that is, surgery on arteries and veins, for this rotation. Let's jump right in. I'm Dr. Amanda Dixon, and today we are most likely performing an aortic aneurysm surgery on a gentleman that we will meet in a minute. One of the things we have to do is determine if he needs a surgery. Specifically, we will be determining if our patient needs abdominal aortic repair. Let's do a quick review to make sure you are up to speed, and then we'll look at his test results. The aorta is the largest artery in the body.
So as you can see, it's very educational as well as interactive for the students. I'm going to try and go to the next section.
Look at these images. The first is an abdominal ultrasound ordered by our patient's family doctor.
So it shows really a lot of real-time images, so the students kind of get that experience, and I think it helps a lot of students maybe decide kind of different areas that they're interested in. So it goes through all the different steps.
I see you found everything okay in the locker rooms. I've already had the patient checked by his cardiologist, who determined that he is a good candidate for this surgery. So we are in good shape in terms of his heart. So we are almost ready to get started. There are two routes we can go with this surgery. We can do an open procedure, where we cut into the abdomen and repair the artery that way. Or we can do a minimally invasive procedure, where a stent graft, also known as an endograft, is inserted through the femoral artery, through the iliac artery, and into the abdominal aorta, with the assistance of X-ray equipment. Given Mr. Bishop's general health, relatively young age, and his personal choices, we've decided we will do the open procedure.
And I apologize for going through this, but I do want you to see kind of the interactive part of the video.
This is Mr. Bishop. We want to get him healthy and happy so he can go sailing with his granddaughters. He's told me all about his sailing jaunts with Savannah, Presley, and Paige. And this seems like a good reason to me to want to stay healthy as long as possible. I'm going to go finish getting ready for the surgery while the surgical team finishes the final steps of patient preparation. Okay, I've checked and the prepping and draping is complete. I've also checked with the anesthesiologist, and Mr. Bishop is anesthetized and his vital signs are good. Antibiotics have been given, and there are blood products available in case there is a lot of bleeding. So our first step
The thing that I really like about this is that it's step by step and it goes through all of the different portions.
is to make an incision down the center of the abdomen, from just below the sternum, or breastbone, to just below the navel.
So now you have to drag the scalpel
Use the Bovie pencil to cauterize the areas of the incision that are bleeding significantly. Next, we'll use the scalpel to cut through the abdominal wall at the midline. Be certain you stay in the...
and that's where I'm going to stop it. This is really cool. I have a lot of fellow teachers and recovery workers and resource paras in my classroom that like doing this as well, and will sit along with the kids and do those things, but it actually goes step by step through the whole entire process of the surgery. So it's just a really cool look into different activities that are available in different career paths as well.